Low blood sugar is not the main danger most people face on Ozempic or Mounjaro. The bigger problem is confusing weakness, nausea, or too little food with a true sugar crash. The people who need the most caution are usually the ones taking these drugs with insulin or older diabetes pills. That is where the real danger usually starts. A true low blood sugar episode needs quick treatment. Feeling weak because you barely ate needs a different response. If you mix those two stories together, you can panic at the wrong moment and miss the dangerous one. Ozempic, semaglutide, and Mounjaro, tirzepatide, do not usually act like insulin shots. They mostly raise insulin only when blood sugar is high. Insulin shots and older diabetes pills can keep pushing even when you eat less. That is why the combination matters more than the weekly shot alone. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs also lower appetite and slow how fast food leaves the stomach. People often eat less, eat later, or stop meals early. That can cause weakness, shakiness, or a drained feeling even when blood sugar is not truly low. Once eating patterns change, symptoms become harder to read correctly. That creates two very different groups. One group uses Ozempic or Mounjaro alone, or with medicines that rarely cause low blood sugar. The other group uses the same weekly shot with insulin or an older diabetes pill. Those two groups should not hear the same warning and assume the same danger. In many cases, the weekly shot gets blamed first. The bigger problem is often the old insulin or older diabetes pill dose staying the same after food intake drops. The new drug is easier to blame because it is new and famous, but the older drug often creates the real low. This matters even more in older adults and in people with type 2 diabetes who now eat far less than before. Low blood sugar does not always look dramatic. It can look like confusion, slower thinking, poor balance, or a fall. Someone may call it fatigue or stress when the body is actually sending a warning. Some heart and blood pressure medicines can also hide warning signs. A person may not feel the usual fast heartbeat or shaky feeling as clearly as expected. That makes pattern tracking even more important. If your warning signs feel weaker than usual, you need more checks, not more guessing. So what should make you worry? Official drug warnings list shaking, sweating, a fast heartbeat, hunger, dizziness, confusion, trouble speaking, or blurry vision. Severe episodes can lead to seizures, passing out, or needing help from another person. That is very different from simple tiredness after a light lunch. Those warning signs matter because many true lows do not start when the weekly shot suddenly becomes dangerous. They start because people are eating much less while insulin or an older diabetes pill is still working off the old plan. That mismatch often shows up after a missed meal, after alcohol, after unusual exercise, or overnight. Timing matters because ordinary fatigue usually does not follow such a sharp pattern. Overnight lows deserve special respect because they are easier to miss. Some people wake up sweaty, shaky, confused, or with a pounding heart. Others sleep through the low and only notice a headache or unusual exhaustion in the morning. A problem that happens while you sleep is easier to miss and harder to treat quickly. If symptoms come on fast and you use insulin or an older diabetes pill, check your blood sugar instead of guessing. A reading below 70 milligrams per deciliter is considered low. That number means action is needed, not debate. If you keep having symptoms and never check, you are operating blind. Some side effects can feel very similar to a true low. The goal is to separate low blood sugar from eating too little, dehydration, or nausea. You need the right label before you choose the right response. For people who keep missing the pattern, a blood sugar sensor can help. It tracks blood sugar through the day and night. It can show drops you would never notice from memory alone. It can also catch overnight lows that explain morning confusion or exhaustion. Once a true low is confirmed, the response has to be immediate. If the number is low and you are awake, use the fast sugar plan your own doctor has recommended. If swallowing is unsafe, confusion is rising, or another person has to step in, this is an emergency. Severe low blood sugar can become dangerous very quickly. Once the low is treated, the next step is reviewing the medication plan. Doses may need to be lowered when these drugs are used with insulin or older diabetes pills. Many patients assume the weekly shot should be stopped first. In practice, the insulin or older diabetes pill dose often needs to be lowered first. Prevention starts with honesty about how much you are eating now. Do not just say the medicine makes you feel strange. Say breakfast disappeared or dinner portions got cut in half. Say you are skipping meals because food feels unappealing. That gives your doctor something real to adjust. A simple symptom log can help more than people expect. Write down the time, what you ate, your activity, any alcohol, your medication, and your blood sugar if you checked it. Memory gets sloppy when you feel bad. Patterns on paper are much more useful than vague recall a week later. One common mistake is treating every shaky moment with sugar before checking. If your blood sugar is normal, repeated rescue snacks can confuse the picture and make the pattern harder to see. That is one more reason to check when you can, especially if you use insulin or an older diabetes pill. Another useful clue is timing after a dose increase. Dose increases matter because you may now be eating less and weighing less than before. A plan that felt safe at one stage may stop fitting after appetite drops further or body weight falls. If symptoms started after a dose change, bring that timing to the review. The timing of symptoms often explains the problem better than trying to remember everything later. A related mistake is waiting for the next visit because the numbers are low only sometimes. Off and on lows still matter. Even occasional episodes can mean the medication balance is already too aggressive for your current eating pattern, body weight, or activity level. Rare is not the same as safe. Because even occasional lows matter, keep fast sugar nearby before the next episode happens. Anyone who has had these episodes, especially while using insulin or an older diabetes pill, should keep fast sugar nearby. Family members should know what a real low can look like and when emergency help may be needed. If severe lows have happened before, ask whether you should keep glucagon, an emergency medicine for severe low blood sugar. The main point is simple. Ozempic or Mounjaro alone is usually not the biggest low blood sugar threat in the room. The highest risk is still in people using these drugs with insulin or older diabetes pills. Risk rises even more once eating patterns change. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.